Hi everybody. As we celebrate International Women's Week, I as a dermatologist and a woman would like to share some information about skincare in women. Now to make it easy, let's divide it into three categories or the three different age groups. One is the Adolescent Age Group, and then we have the 30s and the 40s, and then let's talk about what we see normally in 50 plus individuals. Now coming to the adolescent age group, the most common complaint that the patient comes with is acne. Now why does acne appear in this age? Now it is mainly because of the hormonal variations which causes increase in the sweat gland production because of the androgen hyperactivity. And what happens mostly in this age group is that patients tend to pick or pop these acne, which results in the pigmentation which is seen afterwards and also the scarring. So what can we do to tackle this? The first and foremost thing is we need to control the oil production. So to do that, diet plays a very important role, and in diet particularly we need to concentrate on reducing our consumption of oil-rich foods such as dairy, which includes milk, curd, cheese, eggs, cashew nuts, and as well as chocolates and etc. And also the fried food items. Second, we need to use a very good face wash which controls the sebum production, that is which contains glycolic acid and salicylic acid. And thirdly, use anti-acne preparations, topical medications which contain adapalene, benzoyl peroxide or retinoic acid. Now, if this acne is very severe, that is if it is moderate and severe, we need to consider systemic antibiotics and systemic retinoids. Now, once the acne is under control, then we need to focus on the pigmentation. The post-acne pigmentation and the scarring can be treated by using topical anti-depigmenting creams such as those containing glycolic acid, kojic acid and etc. We can also do chemical peeling, which is a procedure which focuses on the pigmentation. And for the scars, we can go in for microneedling and subcision. Now the second age group, that is in the late 30s and 40s, the most common complaint that we come across with is what is called as melasma. Now melasma presents as a hyperpigmentation or darkening of the skin which starts mainly in the cheek area and then it progresses to the center part of the nose as well as the forehead. Now what is very important here is we should not delay the treatment in such a condition, because once it progresses it is very difficult to revert it. So at an early stage itself, one needs to consult your dermatologist and take an appropriate treatment. Now the reason for this melasma, there are multiple, it's multifactorial in that first of all it can be genetic, second it is because of the UV radiation, and thirdly it can be because if you have any underlying thyroid abnormalities. And again, melasma, once it occurs, it is very important to use a very good sunscreen to protect from the UV radiation as well as topical depigmenting creams. Now the other issue that is seen among this age group individuals is what is called as skin tags or DPNs. Now these appear as small raised pigmented papules which are black in color, which are seen commonly on the face, the neck as well as on the axilla. Now, one thing to assure is that these are completely harmless. There is no problem at all if it remains on the skin, but patients usually present because of cosmetic concerns. And it can be easily removed by doing a simple cauterization, which is a very painless procedure, and there are no other after effects to it. Now, at this age itself, which is the late 30s and the 40s, this is when one needs to start taking care of the skin in terms of anti-aging. Because at late 30s and 40s, small changes appear on the skin which will eventually progress if we don't take care of it. And that is the appearance of fine lines and wrinkles. So in the late 30s and 40s, one needs to consider using anti-aging creams, especially topical retinoic acid, and also vitamin C serum application at night is also a very good option. Now as age progresses, that is as we go into the late 40s and 50s, these fine lines which appear earlier, they start getting deeper and more prominent. The skin starts losing its elasticity and starts sagging, and also there will be increasing thickness of the skin. So this is also the time where topical anti-aging preparations come into a very good role, that is using retinoic acid mainly at night and also vitamin C serum. Now if the wrinkles are really bad, we can always go in for a Botox and a filler injections or doing a plasma-rich therapy for the wrinkles. So I would like to conclude by saying that every woman has the right to keep her skin healthy. So all the women out there, stay healthy, stay beautiful.